As the government shutdown drags on, the battle over Medicaid spending continues. One of the debates is health care for undocumented immigrants who by law don't qualify for federal health programs, but emergency care is still required. Now a new study is highlighting how much that emergency care actually costs. Our ABC 10 News reporter Laura Acevedo spoke to the lead author of the study and shows us what researchers found.
This study specifically looked at emergency Medicaid spending from 2022, analyzing publicly available data from Washington, D.C. and 38 states, including California. Emergency Medicaid, it's one of the many issues at the center of the government shutdown, now in day 17. It's a form of health coverage for people who meet all of the usual Medicaid requirements but are undocumented.
Serious or life-threatening medical conditions that risk, injury to life and limb, or labor and delivery.
But just how much do undocumented immigrants cost the federal government in emergency Medicaid? A new study says not a lot.
What we found was that emergency Medicaid actually encompasses only less than 1% of total Medicaid spending.
Patricia Santos is the first author of a study published last week by the Journal of the American Medical Association. Researchers found that on average, emergency Medicaid for undocumented immigrants made up only about 0.4% of all of Medicaid's budget.
So any reduction through that specific mechanism is going to have very minimal overall fiscal benefit for the federal government, but it can really disproportionately impact the hospitals.
Santos says the goal of the study was to provide a better understanding of Medicaid budgets as the administration proposes cuts to Medicaid and as the government shutdown continues, arguing the data shows cutting emergency Medicaid spending would be just a drop in the bucket compared to Medicaid's overall budget.
So if they want to reduce wasteful spending or bloat, this is really not the way to do it, and it would just cause disproportionate harm to safety net hospitals.
Laura Acevedo, ABC 10 News.